Hello everyone, I hope you're having a good day. My name is Neil. If you haven't seen my videos, I have end-stage liver cirrhosis and a few other things as well. But today I wanted to talk about some of the procedures that you may experience while having liver disease that you may wind up going through. And that way you're kind of prepared and you know what they are. And a lot of them really aren't a big deal. They sound worse than what they are, and I will break those down for you. So, a couple different things that you notice in the beginning of testing. You may get a CT scan, which is pretty common. You just, they slide you, it's a fast scan. They run you through the machine. Or a fiber scan, that's where they actually go and they check the elasticity. I can't speak. Anyway, they see how far gone the liver is, as far as the scar tissue and what kind of shape it's in. Usually that's done more towards the beginning of diagnosis. You may, and then a lot of times they'll do an ultrasound, and the ultrasound is to, about every 6 months or so, they'll have you do an ultrasound just to make sure that cancer hasn't developed, because once you have liver cirrhosis, you're at a higher risk to develop liver cancer. But some of the procedures, first I'll talk about varices. What is a varice? Varices are expanded veins. And the reason why they are expanded and oversized is because of the fact that the portal vein, which is your main artery going through your liver, gets plugged and winds up restricting the flow. Well, that pressure has to go somewhere. And usually most people who have liver disease, their blood pressure on their arm will be perfect because they have all the tension in the liver, and that winds up taking that's holding all the pressure as opposed to your arms and so on and so forth. And as far as varices, like I have them wrapped all around my stomach and also around my esophagus and a few other spots. I have more than what most people do because of my other disease that I have, the Ehlers-Danlos syndrome, because that's connective tissue disease. But that's not in everyone's case, obviously. But they'll usually do a EGD, which is a scope down the throat, about every 6 months or so as well, 6 months to a year. And your doctor will let you know how often you should do these things. And if they find varices, these veins that are expanded, they'll actually band them. They'll put a really tight rubber band like around them. And then that band falls off, and then the varice gets closed. And that way you don't wind up on a risk for it bleeding out or breaking or something like that. When you do have liver disease, you are a bleed risk because your liver is in charge of all the proteins that do almost everything. I mean, you're in growing your skin and keeping your immune system going. Those proteins do everything. So, and the varices, one of the more common ways that people with liver disease wind up passing on is from even one of those varices bursting and bleeding internally, or hepatic encephalopathy, which is ammonia poisoning in the brain. And I'll talk about that in a little bit later. And again, with those varices, they'll do that test about every 6 months to a year. And then when they see them, they bind them, and then they check again down the road just to make sure there's no other new ones. Another thing that you may want to experience is what's called a paracentesis or a thoracentesis. Paracentesis is getting the fluid out of the stomach. It's a long needle, kind of like an IV. You know how an IV needle winds up having like a rubber sheath to it, and then the needle pulls out of it? It works the same kind of way, but it's much longer and bigger. And if the paracentesis is in the stomach, they usually go somewhere around the side, and they'll use a ultrasound machine to see where the fluid's building up. And they'll get that hose right in that area and pull all that out. It is a little uncomfortable. They do numb you up as far as before they put that needle in. It's really not that bad, and it's quick to heal from. There's no real long-term effects to it or anything like that. Some people wind up having to have their stomachs, the fluid pumped out, once a month or even more. I've been lucky. I haven't had any fluid build up in a while. So, and I'm grateful to that. But some people wind up having it fairly often. A thoracentesis, and I've had a lot of those. That's the same thing as the stomach, but on the lung. And with that one, they insert the needle below the collarbone, and they go in that way, and they get that same thing, that hose and that patch of fluid, and they pull that fluid through. And then a lot of times they'll do a culture on that fluid just to make sure that it's not infected or anything like that. I kept on, my fluid kept coming back infected for about a month straight, and then I wound up getting stuck in the hospital for 45 days. The last, when I was actually at my worst shape, and my lung just kept on filling up with fluid, so they had a chest tube in, and that's not as common, but I've been through that too. Basically, they just insert a kind of a big nail between a couple of your ribs, and that one there is a little uncomfortable, but again, they numb you up, and even that wasn't so horrible. It's more of a nuisance with having that hose hanging out of you all the time. That it was always pulling on the skin and stuff like that. That can be very uncomfortable. And then we got the scans I talked about. The hepatic encephalopathy. A lot of times the doctors will ask you put your hands out and go like this, and they watch for flapping. But that's not the only way hepatic encephalopathy can affect you. Basically, like I said, it's poisoning of the brain. It can actually get into the brain and actually cause a mood change, a personality change. You may get confused and forget where you are. You may experience some kind of amnesia for a little bit. It's basically driving your mind insane. I've had a couple bouts of this. The worst one I ever had, I was in a hospital, and it had been so long I couldn't eat because of my other issue. So it had been about 10 days since I had any food, and I was real run down. And for one, I was like having conversations with people that weren't there. That was crazy. And then I would realize they weren't there, and I'd get all embarrassed, and yeah. But the worst part about it was I had kind of a breakdown. I got real paranoid, and the only thing I thought going through my mind was get out. Get out, go, I gotta go. There was no thought of where I was going or how I was gonna get there or how, it was just, I gotta go. And there was no thought process behind it at all. I mean, there was a window in front of me, and even the thought of going out that window, but I'm on like the 5th floor. I mean, normally that kind of stuff isn't normal way of thinking. And that was rather rough. That actually kind of affected me for a little bit. That was a very weird and odd feeling. And like I said, with hepatic encephalopathy, one thing is good to tell loved ones and people you know that if you start acting funny, that this could possibly be it, because you may not realize you're even in it. That moment when I was down, I wasn't thinking, oh, this is just my liver acting up. No, I wasn't thinking of any of that. So it is super important that you let those ones that are close to you know that if this happens, this is what we need to do, go to the hospital, so on and so forth, which is a good idea. Also, another thing they may wind up ordering is a biopsy. I've had that done. Basically, they take a couple cores out, and when I had they insert a needle in, they use an ultrasound again to find out right where they're going to. And then it's kind of a spring-loaded type gun, and they put it in there and they hit the button and it pulls a core out. And they pulled a couple cores for me. When they had it tested, the wording behind it was that the whole sample was burnt out. I didn't know that was a medical term, but apparently it is. The only reason why I'm doing so well actually is because the other disease I have, that Ehlers-Danlos syndrome, hypermobile Ehlers-Danlos syndrome, which is connective tissue disease. Wow, I can't speak very well today, can I? That allowed my organs to move and to make more room for those varices, and that wound up taking a lot of pressure off my liver. So, I mean, that's kind of crazy if you really think about it, that one disease is helping the other one. I mean, but hey, I'm grateful. So those are some of the more common things you may wind up going through. that paracentesis is probably the most common thing you would have done with liver disease. Also, you could wind up getting fluid buildup on your legs. You want to try to elevate them. Usually they would give you some kind of diuretic to wind up taking to, pull that fluid off your body. But if you're, if they prescribe those to you, make sure you take them. And also limiting your fluids every day is a good idea as well. Not drinking so much. I mean, don't get yourself dehydrated, obviously, but you can probably ask your doctor how much fluids you're allowed daily intake. And I think, if I remember right, it was like 1,800 milliliters, which is basically like, I think it's like 2 20-ounce bottles of soda or something like that. If I remember last time I calculated, it was like 2.5, something like that. So, and that was in my case. You always want to consult because every case is a little bit different. My case may not be exactly like yours, and so on and so forth. So you definitely want to talk to your doctor about the specifics of, how much fluids and what type of foods to eat. And you also want to keep high protein. So because your liver's not working right, you need to give it a lot more protein so that it can put out what the body needs. Think of it that if the liver was working right, you would get 100% of those proteins come in, and 100% of them gets put where they need to go. But when you have liver disease, you can put 100% of it in, and only 50% goes of that. Half of that goes to where it needs to go. So that means that we have to double that protein intake to get the use out of what normally would be. So keep an eye on those things. So limit fluids, limit salt. Salt can make you get fluid buildup worse. So you want to limit your salt intake. Vitamins are good. Certain vitamins you want to check with your doctor before you do them because some could interfere with the liver. So you definitely want to make sure. Also, any medicines you take that are over the counter and things like that, make sure that they are safe to take with liver disease. I'm sure you've heard a lot of commercials about, on the radio or whatever, about this medicine and this wonder drug and that wonder drug. And then it says, if you have liver cirrhosis, do not take, or so on and so forth. You hear that a lot. So you remember, a lot of things are processed in the liver. Also, a lot of the different things like the natural supplements, like milk thistle, for example. Milk thistle may help out when the liver is maybe in a fatty liver stage, but once it gets to cirrhosis, actually that stuff can actually do some damage. There's actually some studies out there about this because your liver is already weak, and when you put something into it that's supposed to make it work harder to cleanse it, it can't work harder because it's already only working at a certain level. It's not given 100% like it should be. Your liver is limping along, and now you all of a sudden give it this medicine that it has to work even harder to try to process. So definitely be careful with those things. I'm not a big fan of supplements and all that stuff, just because of the fact that I want to be careful of what they may or may not do. Same thing with cold medicines and things like that. I usually don't take them, and that's my choice. As far as what you do, that's up to you. And also, like I said, if you have liver disease, you definitely want to consult your doctor before you take stuff, which is a really good idea. The last thing is I want to thank everyone for helping me with my GoFundMe and everything. That's in the About section of the videos. Thank you so much. My vehicle wound up breaking down on a trip to my doctor, which is 4 hours away, so sent me way back. So every little bit helps. And the reason, that's not why I do these videos. I do these videos to help people. But if you feel it on your heart, it is in the About section. And again, if you like this video, please give a like and follow. Thank you so much for sticking around and watching, and I hope everyone has a blessed and wonderful day.